Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Wa salatu wa salam ala Rasulihil Kareem ala sahbihi ajma'in. Respected guests, participants, and Ramadan Mubarak to all of you. I pray Ramadan is going phenomenal because it is a phenomenal month. Alhamdulillah. It's a real pleasure to have you here today to the Indus Health Network and a collaboration between a number of organizations, inshallah, which we'll find out about today, and a number of guests tonight. I believe Dr. Abdul Mateen Durrani is going to mention a few words before we actually go live. Dr. Mateen, I'll pass over to yourself and then we'll get on with the program itself. Thank you so much for joining us. Bismillah.
Bismillah. Bismillah ar-Rahman ar-Rahim. Thank you so much, Naeem, for starting this off. Respected speakers and participants, Assalamu alaikum. Thank you so much for joining us this evening for a webinar on the impact of COVID infection in Pakistan and how Pakistan is dealing with it, especially in view of the recent developments across the border in India. So we thought we'll get a panel of experts together to look at what is happening now, because here the Pakistani diaspora is definitely quite concerned, and understandably quite concerned, कि पाकिस्तान में क्या हो रहा है, किस तरह हो रहा है. I hope Allah ना करे कि उस किस्म के हालात वहाँ पे भी पैदा हों. We thought we'll get everybody together to just brief us what is happening, especially people from Pakistan and those who have had experience in supporting Pakistan in terms of various charitable organizations and independent sector. So we joined hand with APNE, which is the umbrella body for the Pakistani physicians of Northern Europe, and other doctor associations in UK to set up this seminar. So I would just say thank you so much for joining us, and I will pass it on to Naeem without wasting anybody's time.
Dr. Mateen, Jazakallah khair. Just a reminder to everybody, obviously we'll take Q&As at the very end, but if you have a question, you can put it up in the panel. Inshallah, and I'll try and keep a track of them as well. If you want to find out a little bit more about the project itself, and for me, you know, I was very fortunate to be actually doing a program on Radio Vaz in Glasgow recently for the actual hospital. It is literally Pakistan's NHS, and it's absolutely phenomenal. Even to me, from what I've seen, it's actually beyond some parts of the NHS here in the UK. So without obviously your support and your duas, it can't be where it is today. So if you want more information, you can go to their website, indushospital.org.uk. And also if you want to highlight a particular speaker, I think there's some settings on your Zoom, you can do that. But questions, inshallah, I will take from yourself in the sidebar. If we have time, we can unmute some of the people, depending on how many people are on the call and how far we get. But we'll try and stick to time as much as possible. I think we're going to kick off, inshallah, with our first speaker, inshallah ta'ala, which is Dr. Zafar Zaidi. Let me just quickly introduce all of our speakers as they come on, inshallah. Dr. Zafar, subhanAllah, is an acclaimed nephrologist and one of the founding members of the Indus Hospital and Health Network. He's currently serving as the Dean of the Indus University of Health Sciences. Dr. Zafar played an instrumental role in building and running the Korangi campus, and later on he has spearheaded the Indus Health Network, Hospital and Health Network, as a director for all new projects, including the 12 hospitals under the public-private partnership program. He's also a key role in setting up the COVID-19 response at the network, which he's going to speak about. And I think the main topics he's going to be covering is about the Indus Health Network's role, COVID response role, and how it's executed, how it's set up, what the current situation in Pakistan is at the moment regarding COVID, and the risks and how they can be avoided, and also how to plan to manage COVID-19 going ahead, inshallah. So I'm going to pass over to Dr. Zafar. Assalamu alaikum, and it's over to you.
Wa alaikum assalam, and thank you everybody for joining in, and my greetings for Ramzan for everyone. COVID has been a difficult time for all of us, especially here in Pakistan. Last year in 2020, when things started to shape up in terms of COVID coming into Pakistan, we realized that we had to plan earlier before being caught off guard. So in 2020, we had a comprehensive discussion about how we're going to respond to it back as early as January and February. Remember that the main crux of COVID started in March when the government acted with lockdowns. So we had started to look forward to, and that I think has been the panacea of Indus, that we have an excellent team which can plan ahead and mitigate any risk that could happen. So we decided that we are going to convert some of the hospital beds into COVID. Remember, this is back in 2020 when things were not so much clear how we should be managing them. But we didn't want our healthcare workers to be at risk. So in a very quick manner, we converted a lot of our hospital areas into negative pressure and positive pressures were put in place, so that the airborne infection would not transmit from patients to staff. People were trained. We changed duties. We had to initially, gradually but very quickly shut down the entire hospital for other elective and emergency things, and it converted practically out of 300 beds, over 120 beds were converted into COVID, and a lot more machinery had to be bought in, borrowed. The government played its part in providing us with that, and we set up an ICUs which were purely COVID related. Patient management as well as their attendant management was taken on board. So in the Karachi area, not only did we change things in terms of the hospital, we started providing diagnostics, because at that stage, COVID diagnosis was a problem, and it wasn't very well adequately set up. So not only in the field, in the hospital, but providing it to other centers as well. We got the partnership that we built with the government, especially government of Sindh, as well as central government of Pakistan, which provided us with the opportunity to give us the equipment and some funds to actually set these things up. But it was the teams at Indus who took on the role and did that. Not only just in Karachi, but our hospital in Badin, which looks after the rural part of Sindh, a lot of it, and our hospital in Muzaffargarh, which is about 40 kilometers from Multan. That became the center of COVID activities in all of South Punjab. And our 5 hospitals in Lahore, they also changed and they started looking after COVID patients. So that was back in 2020 when things started. And Alhamdulillah, a lot of activities in that stage improved the situation, and maybe we plateaued off in the country and things started to look better. We at Indus realized that the COVID patients are going to keep coming even for longer. So with kind donations from all over the world, and with very, very helpful donors, and many of them are here and in other parts of the world, and some of them have joined us here as well today. We actually built a separate unit at the Indus Hospital, which was purely for COVID, a 40-bedded unit made out of actually containers and provided with the appropriate air conditioning and everything, which was to protect them. And that has been running since then. So at the Indus Hospital Karachi campus, a dedicated COVID unit has been running, while we have managed to go back and do all the other elective work that was doing. So those patients with the chronic diseases, with the acute diseases, and those which were non-COVID diseases could also be managed well, and they could carry on. The diagnostic activities has been going on. So in many ways, in diagnostics, in treatment, in advocacy, in terms of patient information, in guiding patients, and in policy making in terms with the Sindh government itself, with the federal government, and Dr. Bari will probably be talking about that. We were instrumental in changing some of the policies nationally, locally, regionally, which helped in preventing as well as dealing with the COVID situation. So that was our response, which has been continuing on even today. We continue to meet, strategize, and look at the figures and see where we need to take actions. At the moment in Karachi, I think the situation of COVID in Pakistan seems to be two-tier. In the Punjab and the KPK, there's a very high numbers of COVID patients, and the strain on hospital beds is significantly large. Luckily for Karachi, this number, alhamdulillah, for the time being is not as bad as we had expected it to be. And currently the hospital facilities available in Karachi, and I'm talking about purely in Karachi, are adequately present for the need that is arising at the moment. We are not run off. The beds are not completely occupied. Oxygen situation in Karachi seems to be under control. It may not be so similar in KPK and in Punjab, where the numbers are much higher. But everybody is watching, with our holding our breaths, and we're hoping that things remain under control and we can, mitigate the situation. How can all of this have been avoided? I think all of this could have been avoided had we been paid more attention to prevention and following instructions by both health authorities, the government authorities, and the doctors. People have been quite laid back and nonchalant, and they've not used masks, and they've been crowding and all of those things, which could have avoided all of that. However, there are often markers available which can tell you that things are going in the wrong direction. I'm glad that we have a national control, NCOC, which is a body which looks at all of these and guides when things are going bad. It will require a collective effort from everyone, not just the Pakistani health delivery system, but the government, the authorities, and the Pakistani diaspora and all our friends and colleagues and well-wishers all over the world, because this is a deadly disease and we are facing it right in the center of it. In future, Indus will continue to play its role in terms of COVID management, COVID diagnosis, helping out. And if, God forbid, Allah na kare, but if things start to go bad here in this city or in any other city, we are determined to play our part. We will change. We will roll up our sleeves even more, as we have done, jump into the situation. And because this is us, this is our people, this is our future, this is where we live, this is where we all belong to, and we owe it to them to do whatever we can do the best. So that's been, in a very nutshell, the response by the Indus Health Network in COVID, and we hope that we can continue to play our significant part in this. And alhamdulillah, we feel that we have led from the front, and Allah Ta'ala, we just hope that Kabul bhi kare for all that we have done, and give us the strength, as well as provide us with the means to help the nation in this difficult time.
Jazakallah khair, Dr. Zafar. Thank you. Fantastic effort, and we pray things are easy, and we learn certainly from what's happening around us. Thank you so much for that. If you've just joined us for this fantastic and insight, inshallah, into how Indus Health Network and generally Pakistan has been coping with the COVID scenario, especially under the healthcare system, and saving the lives of many people, inshallah ta'ala, and obviously what the future holds for Pakistan's healthcare system. Remember, it's been hosted by the Indus Health Network. If you want to find out more information, you go to indushospital.org.uk. And of course, we'll take any questions in the sidebar at the end of the session today. So please do start thinking about what you would like to ask our special guest today. Moving on to our next guest, somebody who's not far from myself, up in Leicester Sharif, as we call it, in the UK, alhamdulillah, is Dr. Samia Latif. She's a consultant, Communicable, Disease Control, Public Health England, also Assistant Academic Registrar, UK Faculty of Public Health. Samia currently works as a consultant in Communicable Disease Control at Public Health England. She's also an Assistant Academic Registrar for UK's FPH and member of the faculty's Global Health Committee, and following special interest groups, which include Pakistan, mental health, diversity and equality, and global violence prevention. She's also chairs the Public Health England's BAME network. Samia is also a GMC appraiser, an educational supervisor, and an accredited mentor. Her areas of interest are health protection, culturally intelligent leadership, global public health, and public mental health. She's also a keen advocate for gender and race equality, and is the UK Diaspora lead for women in global health Pakistan. Dr. Samia, over to you. You're going to be discussing, inshallah, the vaccine myth busting, which has obviously seen a lot of interest over the last 12 months, and how that can support vaccine uptake in Pakistan, and also touch on the global vaccine equity issue, inshallah.
Assalamu alaikum, everyone. It's a pleasure to be here. And without further ado, I will just go into my topic. So basically, I'm here to provide some sort of little nugget or input with a very UK lens. But I think we all need to.
Some of your signal is breaking.
It's a little bit weak, Dr. Samia.
Join in from my phone at the same time.
We'll give you a minute. Yep, we'll give you a minute to do that.
Yep. Is it better now?
Yes.
Yes. Yeah. Okay. So basically, I think COVID has been shown to be the great leveler. COVID doesn't differentiate between gender, between skin color, between faith, between ethnicity. So we must all learn from each other. And some key learning we had from the UK was around the myth busting that we had. And I think the most important message, if I can give one today, is that the message isn't as important as the messenger. Make sure that the message is getting out to people through a trusted source or a trusted messenger, because people will resonate or respond or trust people they already know, someone in their network. And so what the UK found out quite early on, because it was seen that the ethnic communities' uptake of the vaccination was lower than the white British home population. And sad to say that the Pakistanis are still, the Pakistani ethnic communities in England are still one of the lowest uptakers of the vaccine. So what happens is that the Pakistanis here sort of listen to the news back home, and there's all sorts of conspiracy theories. But once you begin to address it, once you begin to use your community champions that you've got, the trusted health networks, go out to people with the message. The vaccine is very important. Extremely important, but so are the other measures. My father was ill, and when I went there, I saw all sorts of things happening. You see them here as well, but it was almost as if COVID doesn't exist. So I think all the messages, all the messaging that goes out needs to go out in a very culturally sensitive way. So for different areas, you'll be using different languages, different dialects. You know, in KPK, you'll be using Pashto and
I think we're having some problem with Dr. Samia's connection again.
Hinko, and then in Punjab, you'll be using Punjabi messages. Engage and galvanize you. Can you guys not? Syed, can you connect me on to Zoom from this email, please?
We can hear you a little bit better now.
So, okay, cool. So galvanize your youth and harness social media. The impact of social media is immense in Pakistan as well. I know not everyone has access to social media, but you'll be surprised that the majority of the young generation in Pakistan do. So utilize that. Regarding some of the myth busting, I think things about it does not chip you, it doesn't affect your DNA, it is safe if you are wanting to conceive a child, it is safe for women, but you
Dr. Samia, I think we're struggling. Can we maybe get Dr. Samia back once she's sorted?
Right. I come onto my phone now.
Okay. Bismillah. Let's try that.
Yeah. Okay. So
much better. Much better.
Basically. So if we can, should I recap everything or just carry on?
Of course you should, and you should. Yes, please just recap.
So basically, I think the key touched upon were about how the message is more important than the messenger. We need to make sure that we are using our trusted community influences, community champions, getting the message out to them in a language they understand. So whether it's Hinko or Pashto, Punjabi or Saraiki or get that message out, get it to them through people they trust. And some of the myth busting can be done in very pictorial ways. I think a picture says more than 1,000 words. So if you can use visuals, use them. Another thing we found was there was a lot of conspiracy theories here about COVID affecting the fertility of women, COVID having a microchip and how it enters your DNA. Can I just stress, I know I'm talking to a converted group here, but the message that we need to get out is that it doesn't do any of those things. It's been researched. Nothing in life is 100% safe, but this is one of the safest bets we have if we want to win this fight against COVID. And it's not just the vaccine, it's the vaccine together with all the other measures. People are undergoing COVID fatigue now. They're not following the mask wearing, the hand washing, the distancing, but I think you need to keep reiterating those messages. And we have seen that COVID has taken far more lives than we thought it would when it started, the pandemic started, and it has caused havoc. The UK is very fortunate in that we have now vaccinated over 2/3 of our adult population have received the first dose, and over 1/3 have received both doses. So I guess we need to see how we can help and support Pakistan roll out the vaccine. So one of the things that we've been talking about in the UK and to the UK government, and there've been a few very good articles on this in the BMJ, is about global vaccine equity. Now, the cost to the global economy of vaccine inequity is phenomenal. It is $9.2 trillion. That is global inequity of the vaccine. So we need to make sure we lobby and advocate for the UK government to release 30% of its pre-purchased COVID-19 stock, which we are doing, invest in scaling up and production facilities and manufacturing capacities in low and middle income countries. So Pakistan should start producing the vaccine and become self-sufficient, and then supporting health systems like Indus hospitals to ensure that you can safely distribute it. It's not just about the supply, it's about the distribution networks and how you ensure that. So I'm going to pause here because I think I may have overexceeded my time. Apologies for the connection issues. I
think you're good. Jazakallah khair. No problem. That was fantastic. The second time round, we're obviously much clearer. Thank you so much for that. There's a few questions starting to come in. Just a reminder to everybody who's attending today that if you want to put a question in, you can put it in the panel and we'll pick them up at the end of all the speakers having put forward their particular perspective of the discussion today. And if you want to find out a bit more about Indus Health Network and the fantastic work it does, you can go to indushospital.org.uk. And of course, we'd love your support and your du'as as well, inshallah. Our next speaker, inshallah, is a colleague of mine at the British Asian Trust, is Kamyla Marvi, all the way from Karachi. It's a very international panel today, alhamdulillah. She's a Pakistan director, and they partnered with the Indus Health Network. We're going to find out exactly why they did that. But before I do that, let's talk about Kamyla herself, mashallah. Joined the British Asian Trust as the Pakistan director in March 2020. She has more than 30 years experience of social sector experience in Pakistan. She had BSc in Social Policy and Administration from London School of Economics, and then MSc in Public Health from London School of Hygiene. Kamyla began her career working in community health at the Aga Khan University, where she was part of the outreach programs in the Sindh province of Pakistan. She then went on to become one of the founding members of a sexual rights and advocacy organization. She's also worked for the International Institute of Education, heading a leadership program, being the executive director of APWA, which is the oldest women's organization of Pakistan, and the Aman Foundation, developing a 5-year multi-donor program for the Bill and Melinda Gates Foundation, the Packard Foundation, and the Aman Foundation. And Kamyla is going to be speaking about why the British Asian Trust partnered with the Indus Health Network from an implementation point of view. What does the trust look for in an organization before partnering, and why this particular network? And also talk about the partnership during the COVID-19 period and other insights on the current situation in South Asia. Kamyla, I'll pass over to you. Thank you so much.
Thanks, Naeem. So I'm going to start with just saying that, British Asian Trust is not a donor organization. Instead, we are actually entrusted by our donors to ensure high impact, effective programs are delivered to those most in need. So the British Asian Trust, for us, it's really important who we choose as our implementing partner. We have to have confidence in them to deliver these quality programs. And, we conduct strict due diligence. We choose partners where we are sure that, priorities such as safeguarding, strong monitoring evaluation, those are all important parts to us. So when we chose Indus Health Network as a partner, it was after due consideration, after a lot of introspection as to who would be the right people to deliver with us on commitments that we've made to our donors. And so these are the standards that we look for, and we are very proud to have had this relationship for the last 3 years with the Indus Health Network for various aspects, which I will just now talk about. So last year, when COVID hit, we knew that we had to move really fast. In March, we saw this crisis looming. We were of course thrown, in disarray, not knowing which way to turn, but made quick decisions. And we launched an appeal at that time. It was, an emergency appeal that we launched for South Asia for COVID relief. And we chose Indus as a partner to deliver, to support for the health aspect of our appeal. So we also had some partners who were looking at livelihoods issues, these are both part of our programming in Pakistan. And Indus was our partner for health. And as a result of the appeal, we were able to support Indus Health Network with a lot of equipment, which we gave. Of this, there was 45 paramonitors, which was for the COVID-19 ward that Dr. Zaidi spoke about, that you had set up with 40 beds at that time. We provided 330 syringe pumps as well. And this was sort of the main emergency response. But we also had an ongoing program in mental health with the Indus Hospital and its partner, its sister concern, IRD. And this was essentially a mental health program. We were doing a lot of community outreach. And we quickly realized that when when COVID hit, that there was also going to be a huge mental health emergency along with the physical COVID emergency that was going to take place. So we changed our program that was already up and running, and we worked with our partners at Indus and at IRD to change the program, and we switched to helplines where lay counselors did daily check-ins through, so it was coordinated with all the testing that was happening at the Indus Hospital, and patients who had tested positive were receiving calls from this helpline to just check in, provide emotional support, provide behavioral and coping strategies, a lot of time of anxiety for everyone. And these calls were being regularly made. And I can guarantee you, I received one because I had COVID in the middle, and I received a call from Indus as well. So I can assure you that it was up and running well. The lay counselors also were receiving calls at that time. So there was a helpline, and this is still up and running, where people were calling in with their fears, their anxieties around mental health and around COVID-19. So there was a lot of information being given out as well. Up till sort of in the first half, because we had a quiet period once COVID had sort of receded in the past. Over sort of 41,000 people actually were reached in this way through these helplines, and 25,000 were actually screened. More than 25,000 were screened for actual mental health issues. So people who had more serious concerns were screened and then referred for further care to psychologists, psychiatrists who were part of the panel at IRD. And in addition, the other piece of work that the counselors were doing for mental health was that they were reaching out to the Indus doctors, the Indus staff, Indus medical teams to do support groups. It was at the beginning of the pandemic, there was a lot of anxiety, there was a lot of unknowns that were there, and the team worked to reach out to frontline workers and do support groups and really help them to cope with some of the anxieties and stresses that were going on at that time. I'm not sure I can add much from the medical point of view in terms of insights on South Asia. I think there's an esteemed panel here who's probably much better at doing that, but I would like to stress the mental health aspect, which is, the area that at British Asian Trust we are very concerned with, and that we continue to support even now. Pakistan has been through much strife. We've been through conflict, we've been through disaster, we've been through extreme poverty, we've been through, economic downturns, struggling economies, and we have an extremely young population. So we know that the mental health aspect of the current disaster is going to have long-reaching effects on our population and our ability to cope and be resilient as a nation. And I think that we must continue to have significant investment in the mental health programs that go along with the course, the physical treatment that's perhaps sometimes seen as more urgent needs. But we must continue to also support this side of the COVID pandemic, which is going to have, we expect, some serious repercussions on the population in the long run. And just to end, just want to say that we're really proud of the work that we have done with Indus as our partners. We have seen really good impact in the work, and we continue to hopefully work in this neglected area in the long run. Thank you.
Thank you so much, Kamyla. Jazakallah khair for that absolutely brilliant insight into why and who we look for a partner when it comes to British Asian Trust. Brilliant. Right, we're going to move on. A reminder once again, if you have just joined us, or just a reminder generally, that if you have any questions, please do put them in the chat box on the side. We'll pick them up at the very end. And if you want to support the hospital, you have more information that you require, you can go to indushospital.org.uk. And of course, we'll find out more as the evening goes on. Our next speaker is Dr. Faisal Aziz Ahmed, who's the Deputy High Commissioner for Pakistan in the UK. Let me introduce him before I tell you exactly what he's going to be speaking about tonight. Dr. Faisal Aziz Ahmed, born in 1974. Mashallah, you're at least 12 years younger than me, alhamdulillah. Dr. Ahmed received his MBBS degree from Rawalpindi Medical College in 1999. He joined the Foreign Service of Pakistan in 2002 at the Ministry of Foreign Affairs, Islamabad. He's held the following positions: Assistant Director for Afghanistan, Director Central Asia, Director ECO as SCO, Director Program Foreign Service Academy, Director Policy Planning, Director General Strategic Planning, Director Strategic Communication Division, Director General of that particular post, and also assignments as a diplomat to Deputy Head of Mission in 2014 to 2018 to the Embassy of Pakistan in Abu Dhabi. And at the moment, he's a Deputy High Commissioner of Pakistan to the United Kingdom in London. Absolutely fantastic to have you with us tonight. And I'm going to pass it over to the High Commissioner.
You're on mute.
Dr. Faisal, you're on mute at the moment. I know, even despite the fact we've been on Zoom for a year, we all make that mistake. You just need to press the mute, the microphone button. That's it.
Can you hear me now?
Yes. We can indeed. Thank you so much.
All right, wonderful. Thank you so much for this lengthy introduction. I should say I was a member of your fraternity, but I left the medical profession some 20 years back. Members of the Indus Health Network, Association of Physicians of Northern Europe, distinguished panelists, Assalamu alaikum. Right. First of all, thank you for inviting me to this very timely webinar on stock taking and the situation in Pakistan. It's timely because we are in the throes of yet another wave of the infection, and it is pertinent because not all too often, the deluge of information diverts us from what really matters, what is really relevant. Time is short and many of us are fasting, so I'll not burden you with lengthy monologues. But let me state upfront, on behalf of the High Commission of Pakistan and on behalf indeed of the government of Pakistan, how proud we are of the contribution that you're making to the fight against COVID pandemic. What you have done here, what you have contributed back home, and how much you as a healthcare professional community have sacrificed. If this is a war, and it is, you are our frontline defense, and the nation salutes you. We lost 124 people yesterday, 104 before that, over 18,000 altogether. These are not just statistics. These are lives, these are livelihoods, these are families. Since the beginning of the pandemic, we have had to face the twin challenge of a very real public health crisis, compounded by a very real economic one. At the micro level, this translated into an impossible choice between saving lives and saving livelihoods. The challenge was acute because our healthcare system, as you all know, is fragile, and our economic buffers to weather such unprecedented shocks are limited. Our Prime Minister was nonetheless always clear: one objective could not be sacrificed at the altar of the other. By the grace of Allah, we managed to come out of the first wave relatively unscathed. Our worst fears, the kind we are seeing play out in a country in our region, of overrun on our health facilities, mass unemployment, severe economic shock, did not materialize. State institutions got together, the public cooperated. Despite difficulties, the government put in a stimulus of $8 billion. Public health infrastructure put in place to combat other diseases was repurposed. And you, representing the healthcare professional community and the civil society, made wonderful contributions in the shape of your expertise in kind and in cash. Now, a second wave, more sinister than the first one, is upon us. We are perhaps better equipped this time around in the shape of the vaccines and in the shape of the clinical experience that we now have in combating the virus. In response to the growing peril, the government has instituted timely lockdowns. Armed forces have been called in and SOPs are being more stringently implemented. Some areas, such as the capital, are registering declines, but there's no room for complacency. Regrettably, this means that Eid will be very different this time. But then we are also faced with a different set of challenges than those that we faced before. Let me outline a few to you. Among the general public, a sense of complacency has set in, fueled by misinformation. There are unfounded apprehensions about the vaccine, and this was spoken about earlier. Many are simply not buying into the need for protection. Vaccine uptake is therefore challenge number one. The virus is mutating at an astonishing pace. We have seen new and more dangerous variants emerge in other parts of the world. To keep ahead of the curve, we need to have genomic sequencing capabilities. Our capabilities are limited as yet. That is challenge number two. Pakistan has made important strides in indigenizing many of the resources and equipment needed to combat the virus. I'm referring to the manufacture of remdesivir, the Consina vaccine, and whence in Pakistan. That's all welcome, but given the spike in demand, we still urgently need equipment and medicine from outside. Let me share with you that right now, we are in need of ICU vents, positive air pressure machines, oxygen cylinders, oxygen generation plants for 30 to 50 beds, cryogenic tanks, cardiac monitors, ABG machines, UV lamps, pulse oximeters, and nasal cannula. In addition to liquid oxygen, vaccines, Pfizer, AstraZeneca, Moderna, and others, and drugs, including remdesivir, tocilizumab, and IVIG. This is where I think you can be of great assistance. I have the quantities with me from NCOC, and I'll be passing them on to the organizers. Through this forum, I would like to make an appeal for assistance any way you can. Let me also share that we have also shared this information, this requirement, with the UK authorities as well. We are in conversation with them and hope to receive a positive response soon. Of course, UK is a big funder of the COVAX project, and under COVAX, we have received a batch of vaccines, AstraZeneca vaccines, very recently, I believe yesterday. Finally, the knowledge gap, the cooperation we need in sharing expertise in real time, I believe still needs to be bridged. During the first wave, Pakistani physicians here took the commendable step of linking up with institutions in Pakistan and providing with consultations online. I would encourage you through this forum to re-energize your efforts in this direction. And on a final note, as has been talked about by my predecessor, I also strongly feel that mental health dimension of this pandemic, particularly the mental health dimension of the caregiver and what needs to be done to shore this up, has perhaps not been as adequately addressed as one would desire. Thank you once again for the opportunity. May Allah be with us all. Thank you.
Thank you, Dr. Faisal, so much for that insight and also requests for support, inshallah. We're always here. We love Pakistan, and we're always here for you, inshallah. And we'll obviously take some questions later on as well. So a reminder, once again, if you are tuned in, if you have any questions, please do put them down. It's really starting to fill up, and let's see if we can try and get through as many of them as the evening goes on. And if you want to try and support and find out more information about the Indus Health Network, you can go online to indushospital.org.uk. Our next guest is a very dear friend of mine. I regard him as a mentor and as a teacher. He's always the life and soul of the party. So today, I'm sure they won't let us down. Is Asif Rangoonwala, who's going to be speaking about his support for the Indus Health Network from an individual as a philanthropy perspective, and also the British Pakistan Foundation lead why it's important to engage professional and corporate networks to support this vital work. As an introduction, Asif, mashallah, is a successful business entrepreneur with interests spanning food, poverty, sports sector. He's also heavily involved in philanthropic activities through the Rangoonwala Foundation established by his late father, may Allah bless him. He's the founder of the UK-based Eurobuns Limited, a hugely successful venture in the industrial baking sector. I've never had one yet, so he needs to invite me over for that, for which he, mashallah, received the Queen's Award. He's also a fellow of the Duke of Edinburgh's Award, trustee of the Whitefield Development Trust, and director of Indus Entrepreneurs UK, and chairman of the World Maimon Foundation. Asif bhai, assalamu alaikum.
Wa alaikum salam.
Over to you. Alhamdulillah.
Thank you, Naeem bhai. Thank you very much, and thank you to Indus for having this event today. I think everything Naeem said about me is a little bit overdone, but I'll accept them. Okay, I'm not going to deny any of that. Mashallah, I've been extremely lucky to be in this position where I can assist, and I'm going to only talk on two issues. One is what Dr. Samia raised about the British Pakistani diaspora in this country, and my only word to them as somebody who represents the diaspora across the board in the UK, that please take your vaccines if you're getting them, okay? And all this, after listening to all the expertise that we've heard, there is no reason why, unless you have a specific medical reason, that you should not be taking this vaccine. So that's my appeal to the community, to the diaspora, that please, and if there are any questions, we've got so many experts within the community who can address any issues that you might have. As far as the BPF is concerned, I will let you know that we are in the position to have our first BPF hub based up in Rochdale, which is going to be initiated sometime by the end of May. And through that also, we hope to be able to provide vaccinations and any assistance or knowledge that is required. The second reason that I agreed with Dr. Mateen, who was very kind to invite me to this session today, was that to talk to you a little bit about Indus. So I have known Dr. Bari for, I think, 20 plus years, and also Dr. Zaidi. And I must say that from very humble beginnings, and even today, he is one of the most humblest people I know. And I believe that what Indus has done for Pakistan, very few people would have. In today's market of 220 million people, to have a medical service like Indus is unbelievable. And I don't believe that it exists anywhere else in the world, okay? I think somebody compared the NHS. I believe this is the NHS, but you can multiply it many times, okay? Because they don't have the funding from the government like the NHS does. And I must thank the people of Pakistan and for the Pakistani diaspora who lives abroad, all the NRPs that we've got, the non-resident Pakistanis who continuously, I think Dr. Bari and Dr. Zaidi can back it up by saying they're continuously providing the assistance for Indus to do the, I suppose you can call it a miracle. Fantastic. So my compliments and my backing and my support will always be there. I think as a member of the UK diaspora, with British Pakistani diaspora in the UK, we have also got an agreement with Indus that whatever monies we raise, part of that funding would go to Indus Hospital. In the meantime, while we are still waiting for these people to give us the funding, Rangoonwala Foundation is continuing to help Dr. Bari and the mission of Indus Hospital. And again, as I said, I cannot say enough about the fact that the work that they do is just exemplar. Thank you very much, Dr. Bari. And thank you.
Asif, thank you so much for those touching words. Allah bless you and your family, inshallah. We're going to move on to our last speaker. Last but not least, subhanAllah, is Dr. Abdulbari himself. And before he speaks about overall the Indus Health Network's role in Pakistan, the current insights on the COVID situation in the region and the impact of COVID-19 on other work that they've been doing. And, I was just blown away by the fantastic boat hospital or the ship hospital that you put together. And that just shows you the reach that you're trying to make sure that everybody in Pakistan is touched by, equal healthcare. Let me introduce Dr. Abdulbari Khan. He's the CEO and founder of Indus Hospital and Health Network. He's one of the founders and CEOs, as I mentioned, in 2007, with the support of a few friends and entrepreneurs. He established a 150-bedded free of cost hospital in one of the largest slum areas of the largest city in Pakistan, in Karachi, Korangi, and also in recognition of his selfless services for the country, he received number of medals, Tagma Imtiaz, Hilal Imtiaz from the government of Pakistan for his fantastic efforts. Dr. Abdulbari, Allah bless you, and you've, mashallah, sown the seeds of something that's now, you know, alhamdulillah, taken over the country, and I think many other countries will hopefully take a lead from this as well. So it's not just in Pakistan. I can see internationally people are watching us very closely, and may Allah bless you for the fantastic Sadaqah Jariyah, which it is, and everybody who's involved on this platform today and has been on that journey. So I'm going to pass over to you to conclude before we take, and we've got lots of questions, subhanAllah. So over to you. Jazakallah khair.
Bismillahirrahmanirrahim. Thank you all, and thank you, Asif for very kind words and the support which we got from your organization and yourself. So whenever you come, you visit in this hospital, that gives us energy to do more. So I started in 2007 as a 150-bed hospital where people were skeptical that this hospital will not run. We might be able to make it, but to run it free. Someone gave us a month, 6 months, and max in a year that we'll be starting charging money. But within 13 years, it has evolved into a health network with 12 hospitals across Pakistan, 4 renal blood centers, 4 physical rehabilitation centers, and public health and primary health programs in 41 districts of Pakistan. So regarding the COVID response, I still remember the first case of COVID was reported on 26th of February in Karachi and Islamabad simultaneously, 8 p.m. at night of 26th of February. In the morning of 27th a.m., I got a call from Chief Minister's House. There's an emergency meeting in CM House regarding the COVID-19. And a task force was established where I became the part of it. And since then, we've met on a daily basis for months and months to control. And fortunately, in that same meeting, the COVID-19 was brought in Pakistan by the community who came back from Iran. So they were isolated. They were contact tracing was done. The administration managed to get the data from the Iranian embassy for the last 3 months, how many visas were issued, how many people went there. And a lot of work there was done within 12 hours. So it was a pleasant surprise that in the government setup, such a detailed action was taken and they had the data. So, but they had a problem. So the Chief Minister said, we cannot, with the systems in the government, we will not be able to manage this emergency, and we need their support. So they asked us if Indus can help us so to do it, and they gave us about 300 million rupees, and within a week, there were 2 hospitals building in Karachi, in Gadab and Dubagod, where we equipped it. Within a week, one of them was 120 bedded and the other was 200 bedded hospital. So within a week. So I went back from that meeting. I called different vendors, all ventilators available in Karachi. I got hold of them. I got hold of the PCR kits, and we started our lab. So, and not only our lab, we then established labs in different parts of the Sindh also, we helped them. And similarly, we helped the Punjab government also, because as Zafar mentioned, that Syed hospital in Zafar was declared a COVID hospital for all Zaidin coming back from Iran. So we worked with the government, and then the government formed a Corona Emergency Fund where I was made a member of it, and with Mushtaq Chhabra and Faisal. And then we managed to import equipments, PPEs, PCR kits from UK and other parts of the country, and established many labs across them. So for 300 billion rupees, we bought about goods worth of about 10 billion rupees by our negotiation skills, alhamdulillah. So the first wave, you saw Pakistan reacted very fast, and there was complete lockdown in Sindh, which was quoted internationally, and how, and this was a good example of a private-public partnership between the government and Indus Hospital, which resulted in the timely control of that pandemic. And when after the first wave, then we were managed to, we were the only setup in the big thing, as Zafar said, that we established 120 bedded facility for COVID. The other public sector hospital had only 10 or 15 beds. So I urged the government to increase the capacity because the second wave will come. And then within 3 months, the capacity of public sector hospital was increased, and we were able to manage a second wave very efficiently. Now the third wave came, which was more towards the northern part of Pakistan, which is KPK, Punjab, and AJK. And it was like affected by the UK variant because there was a complete lockdown in UK. So Pakistani diaspora from Maypur and some part of Punjab, they came back to Pakistan, and some of them brought that viral variant, and which was very notorious and spread very fast. And the situation became very, very bleak in Lahore. And I got a call from the Minister of Health from Punjab, and she asked us to establish COVID unit in 4 hospitals, which we are managing for government of Punjab. And when she called me at 12 midnight, that she has only 10 ventilators available, and there are many patients out there. So within a day, we brought into the system 17 ventilators, alhamdulillah. And the situation in Punjab is now under control. And about 2 hours back, I got a call from the Minister of Health that she wants to establish, excuse me, establish a vaccination center in all 4 hospitals in Lahore and in Muzaffargarh also. So this has been possible, and then the response which we got from the diaspora, Pakistani diaspora, and from the corporate sector and the philanthropists in Pakistan, it is exemplary. We as a nation, in the normal days, we are disintegrated, but whenever there is a natural disaster, be it earthquake of 2005 or a flood of 2010 or 2011, or the pandemic of last year, this nation is united. And the response which we get from this nation is exemplary. And alhamdulillah, hopefully, inshallah, we will all be able to curtail this third wave also. Thank you.
Thank you.
Jazakallah khair, Dr. Abdulbari. Thank you so much for that. I'm going to open the floor for some questions. So let's just take the questions that have come in at the moment. Dr. Syed Latif, is there a plan in place to provide mental health support for the healthcare workers who are providing support? Interesting question. Who'd like to take that one on board? Is there a plan to provide mental health support for the healthcare workers who are providing support? Can somebody take that?
Can I maybe answer that, because
yes,
that was that actually was the work, Dr. Syed, that we were doing with IRD to actually reach out to the frontline healthcare workers. We found that actually it was really difficult for them to take time out because they were exhausted. It was a matter of, do I go for a counseling session or do I actually catch up on my sleep? So it was not always so easy to find the time to talk things through. Over time, the anxiety did drop. Because of course there was greater understanding and rates of the pandemic reduced. But at that time, it was really difficult times last year around June time, when I know that, there was a lot of concern. A lot of people were really suffering from, what they were seeing in the hospital. And we were able to have those sessions with them at the time. They're still available. The counselors are still there, but I think the demand is now from the frontline workers a little less so.
Okay, anybody want to add on to that?
Yes, if you allow me. Yes, I agree with Kamyla that I think the demand has been less. I think in the first wave, the fear, the anxiety, the lack of PPEs, the protocol that was not known, how things were done, they have changed, and a lot more has happened. I mean, my own daughter-in-law works in a COVID unit, so goes every other day, does the duties, comes back, and it's fine. So that has changed, and I think the anxieties that we had previously are not so existent at the moment. However, the warning: if there is a overrun on health facilities, that anxiety is going to come back. We see it in television across the borders, how the doctors and the medical staff and the healthcare workers are being exhausted with the number of patients and which they cannot manage. And it's when the deaths becomes too many, and you have to choose between who you want to allow to be on the bed in an ICU and who you can't. That's when things go wrong, and that's when the need really arises. So I think the markers are out there, and for all those who want to help out with the healthcare workers in the mental issues and coping with it, be wary when the situation, if the God forbid, if the situation goes out of control and gets worse, whatever we have learned from now will become redundant. We will need all of that help again, and everybody will have to chip in at that stage.
Let me take the next question. This is should the UK authorities have acted sooner to shut down travel to and from India and Pakistan? And I suppose there's many people stranded in Pakistan and India as well. Should the governments have acted sooner with regards to travel? Who'd like to answer that?
I can chip in here from a public health point.
Dr. Faisal might be interested to hear from yourself as well. But Samia, please, Dr. Samia, please go ahead.
I think when these decisions are made by governments, there are lots of factors that are considered, and it's not just the infection rate of the country, the destination country. In the case of Pakistan, it was actually the number of people flying from the UK to Pakistan, which prompted that. At that time, the rates in Pakistan weren't that bad compared to other countries. And there was always a comparison made versus why India wasn't put on the red list at that time. So, but the amount of people that have flown between the UK and Pakistan has been incredibly high, exceedingly high. And Dr. Bari said, the variant was then brought in and vice versa. So that was one of the factors. There are many factors that the government considers when it's making a decision like this. It's not just one variable. So it's more than one variable.
Dr. Faisal, you want to mention anything about maybe the governments, India, Pakistan, and UK should have all acted sooner?
Yes, thank you. As the government representative, I can't comment on another government's course of action. So I won't say whether they should have acted sooner or whether they acted rationally. But initially, when they imposed the ban, we did not understand in Pakistan what was the rationale for it. Because true, there were a lot of people traveling between Pakistan and the UK. But as Dr. Samia mentioned, the level of infection in Pakistan was not that high. And we did not have the variants of concern that they were trying to prevent coming in. On the other hand, there were a lot of people coming in, British nationals going to Pakistan, British Pakistanis, carrying the UK variant to Pakistan. And you must have seen reports saying that much of the variant that's now spread in Pakistan is the UK variant. So maybe, perhaps, again, I'm not one to speak for, it should have been the other way around. But having said this, we look forward to an early end to these abnormal restrictions. They are cause of a lot of distress for a lot of people. And let's hope we are able to get over it as early as possible.
Inshallah, brilliant. Let's go on to the next question. Unless anybody's got anything specific to add, you can put your hand up for the panelists. Vaccine hesitancy is a big issue in the UK, particularly with the Pakistani community, and it seems to be magnified in Pakistan as well. How do we ensure the message is getting to the people who need it most? A typical response seems to be, this is a rich person's disease, I will not be impacted. Who wants to take that? Dr. Sami, you might want to come in there.
pick that up, and I'm more than happy to talk offline about improving vaccine uptake and decreasing vaccine hesitancy within these hospitals. But we've done a lot of work, and we actually engaged behavioral scientists to look at the reasons that the uptake has been poor in not just Pakistani communities, but other ethnic communities. And it's multifactorial, it's not just one thing. People believe a lot of conspiracy theories, and people believe what's being said from home is not that serious, nothing's gonna happen, it's a pharmaceutical ploy, etc., etc. But the key thing was, if you explain the information to them in clear, simple language, using pictures, get the message to them by someone they trust, sit down with them. You need to listen to people's concerns. To be very honest, my hubby and myself, we looked at all the information when the vaccines came out. We made an informed decision. But being medics, we are privileged to have access to that evidence, to be able to make that informed decision. The general population isn't, and it is only natural that they will have concerns, they will have fears, and that's all that, of course, hyped up by all the conspiracy theories. So I think you need to unpick them, and there's a lot of behavioral science work that's being done in the UK on ethnic minorities, especially Pakistanis, and we'll be more than happy to share that within this hospital. So it's very important. The messaging is really, really important.
Anybody want to add anything to that?
I think in Pakistan, we saw a little change when we saw the pictures and what we saw on television and news from across the border. There has been, actual fear of COVID, and the number of people getting themselves vaccinated has increased. Not as much as it should, but I think Dr. Saiba, Dr. Samia was correct that visuals, pictures, messaging, who does it, they really, really matter.
Taib, inshallah, let's go on to the next question, which is about India and Pakistan. Are we anticipating, and several people have mentioned something similar, anticipating sadly a similar tragedy that's happening across the border in Pakistan? What are people's thoughts as to, is that going to happen, and how are we ready to cope with that? Anybody want to pick that up?
Okay, yeah, please go ahead.
We get international data every day, and so we've been following the trajectory. The trajectory for India was very steep. The one for Pakistan is not as steep. However, if you look at the population count in India, their population is immense. But Pakistan shares a lot of variables with India. So nothing with COVID, the one thing we've learned is that, Allah subhanahu wa ta'ala knows best and we don't. So we can't predict anything, but we must take measures. We must take measures. We can't take this lightly.
Dr. Abdul, you want to mention something?
Yes, I agree with
please.
Samia. And when the situation across the border became worse, so we asked our government to close the borders, because that is important, because only by closing the borders, but we cannot see where the people are coming from, because the Indian going to Middle East and the Pakistan intermingling with Pakistani population and the Pakistani population. So we asked the government to take strict measures at the airports, and now they have started antigen test at the airports, and if they are positive, then they get so they are doing taking some measures. And the thing which I think which is we manage very efficiently in Pakistan is the mechanism of the NCOC and the coordinated effort between the provinces and the center, and collecting data and then analyzing data and reacting according to the data. I think that has helped us out.
I think the one thing, you're very right, Dr. Bari, the one thing that COVID has also shown us is, and we've known that with other infectious diseases, germs don't recognize borders. Borders are porous. Germs will just travel. So any measures that you can take, whether it's at the airports or travel restrictions, etc., yes, definitely.
Interesting question following on from what we mentioned. Is there any hope that Pakistan will achieve herd immunity given our population vaccine hesitancy and a lack of vaccines? I mean, that's a point that obviously India kind of went through at one point. Anybody want to take that up?
Samia, then I'll follow up.
Okay, so apologies, I seem to be answering a lot of the questions, and probably because I'm from public health. But please chip in, everyone. I think it's very hard to actually define that. Right, we just need to do what we can, what the best things that we can do, which is in our gift and which is in our power to do. But it's really hard to put figures and numbers. But one thing that Dr. Bari said is about collecting the data. If you've got good data and good epidemiology, that really, really helps inform action, because data should lead to informed action. So that's one thing I think that we can really, really support Pakistan to improve and doing. You're already doing it, but it's very hard. Herd immunity, the concept that has been ridiculed across the West and everywhere, whether it is achievable. And if we've got the variants emerging, herd immunity is not going to be entirely possible at this point in time, unlike how we defeated smallpox. But maybe let's see how things go. But getting the vaccine out to the people and getting the people to take the vaccine is the best step we can take, rather than just focusing on herd immunity at this stage.
Let's move on to the next question.
With you.
Thank you for
Samia,
that.
I agree with you.
Sorry, I think somebody wanted to mention something. Yes, Dr. Abdulbari.
Yeah, Samia, I agree with you, but the population of Pakistan, 220 billion, and the only government setup is providing the vaccines. I think so. The public sector, private sector should be encouraged, and the not-for-profit sector should be encouraged. It has to be a collective effort. The only government cannot achieve this. If they think they can do it, it will take years to them to achieve herd immunity. So it has to be a collective effort, because the people are there who can afford, and they can afford a private vaccine. So we should have options available for every sector of the population. The poor population should be done by the government free of cost, and the middle class can be done by the not-for-profit, and those who can afford. We have seen many people who have permanent residence in Dubai. They went to Dubai and got their vaccine done. People have went to USA and got Pfizer vaccines. So every sector of the population should have an opportunity to have it.
Brilliant, thank you. And we can pick up some of these other points later on as well. Next question is Syed Ahmed is, how can diaspora communities best support medics, planners, and public health officials in Pakistan? There are lots of people wanting to help, and of course it's important that we do so in a coordinated way. Interesting question. How can everybody sitting in Leicester, London, Glasgow, who has medical experience get involved? Who wants to answer that question? Because that's anybody want to take that on?
I think so. As a good gesture from the Pakistani diaspora, and we have seen this since the beginning of Indus Hospital in 2007. Pakistani diaspora living in USA and UK, they have come help us out in bringing new technologies, and there is room for all public health people and Pakistan diaspora to have and we have seen during this last 1 year, the APNI have taken many projects with Pakistani diaspora, Pakistani population here also.
Okay, where are we? I'm just trying to look at the 3 questions. Can we trust the official statistics for COVID in Pakistan? Is Pakistan testing enough? Who can give us an insight into that?
I'll start off. Pakistan is definitely not testing enough. It took a long time for us in the UK to reach our capacity and capability for testing. You need a lot of resource. I don't think we are testing enough, especially in the rural areas, and people not coming forward for testing. And testing, it's not mandatory, but so we're not testing enough. And that would, of course, influence our statistics.
I agree with Dr. Samia, but the capacity which we had, and it is costly. It is costly because most of the testing capabilities and the kits have been provided by the government, and it is costly. And one thing I think the strict lockdown in the first wave, has prevented from mainly the urban cities of Pakistan has been affected by this COVID-19. Our rural areas has been spared. We have done some testing there in the rural areas also, but I think so that was the difference between Pakistan and India's response, because India also did a complete lockdown across the country, but they told their people to go to their homes. So from the urban areas, they took to their rural areas, which Pakistan did happen in Pakistan.
I'd like to add one thing, that when you are short of funds and you're limited in terms of what you can offer and do, I think at this stage, vaccination is far more important than testing. Yes, testing is definitely very important, and we are way below in numbers in terms of testing. But what we need to be concentrating on is vaccination as prevention, because at the current rate, it will take more than 10 to 20 years before we'll be able to vaccinate everybody. So that needs to speed up. If any effort, if any funds that could be available, and a choice was between increasing testing versus increasing vaccination, I'd vote for increasing vaccination as much as possible anytime.
So vaccines definitely seem to be a solution. On that note, talking about solutions, Dr. Abdulbari is putting a question forward to say that we should be careful how we tackle COVID-19 in Pakistan. Only money and equipment will not solve the problem. We need a robust staff development process in place. If Allah forbids a wave does happen, it's likely services will be overwhelmed. How does the panel see the role of expeditious staff development?
I think the staff, yes, I'll take that. I think staff development over the year has been happening. The numbers of human resource that we have available, that is short. So you will not be able to develop intensive care specialists or intensive care nursing overnight. We'll just have to, train them, and which we have tried to do that for a short course, and trying to make them cope up with what is required of them for that particular moment. But in the long run, until unless there is a change in policy where more effort, energy, and funding from the government is put in for the health in the budget areas, then in the long term we can do the development of staff. But if things start getting worse, it will have to be, it will be like a war-like situation where you just have to deal with what you get and train as many people as possible. For that, courses have been developed, a lot have been done online, a lot of local groups as well as international groups have been training staffs of different types to cope with that situations. But we just have to play it by the ear, because time is not on your side when things start to go wrong.
The other thing which we can do is...
You had your hand up?
Yes.
Sorry,
Dr. Bari, please go ahead.
The other thing because we cannot, as mentioned, because we have short courses, but the other option which we have is a tele-IC. So we have to work towards that also.
Yeah, what
Dr. Mateen, what would you?
Yeah, what concerns us or people here, that when you look at the government figures, Government of Pakistan figures, they are very minimal. I mean, so far they say the confirmed cases around 855,000 and deaths around 18,500 in total so far. This is the sort of today's figures, so to speak. And a total critical patients as we speak now is just around 5,000. Looking at the population, looking at how our sort of environment variables are more or less the same as India, how much can we believe this? And if that is the case, then we don't have to worry. Allah ka definitely ehsan hai, karam hai hum pe, that nothing is happening. But looking at people around us, countries around us, Iran, who are India, we are seeing China or anybody. I mean, they are far, far ahead in terms of morbidity. How do we explain that?
Good question, but I think so. The numbers and contact tracing done, we can rely on that. So whether I sit on those, the parameter which I take it basically when there is a surge. So while we are on the front line, so we get calls from left, right, and center. So we get about 40, 50 calls a daily that they need a bed.
Mm-hmm.
And then for last 4 months, there was sudden decrease in the calls, which I used to get. The panic calls, we didn't got the calls for the last 3 months. But in last 2 weeks, then the calls started rising again, getting 5 or 6 calls a day. Now for last 2-3 days, now I think so there's a plateau now, because now for last 2-3 days, I haven't received a single call. So that we can. I do not basically. Allah ka karam to hai definitely. वो तो definitely hai.
Because otherwise it's unbelievable that everybody around is suffering but us as bad.
Sir, बात ये है कि जो हमारा I think so कि जो population, it's more into the affluent because they travel and they intermingle. और वो पानी भी वो नस्ले का पीते हैं, तो हमारा जो रूरल एरिया, जो हमारा अर्बन सबर्ब है, वहाँ पर आप देखें तो वहाँ पर तो इतना गन खाते हैं कि इनके ऊपर तो कोविड ने कोई असर ही नहीं करता है, लगता ही है क्योंकि with a strict lockdown ये सारे जो जगह लियारी शहरी you could मतलब वहाँ तो ऐसे ही था नॉर्मल है, तो उससे ज़्यादा ही रश होता था, तो and they were not affected. We can see.
Yeah. Dr. Faisal, you got your hand up.
So just two things I want to underscore. Replying to Dr. Mateen Durrani's query, India is definitely a cautionary tale. We can't take our eyes off the ball. Mm-hmm. Yes, we have been very lucky, I think. And one of the reasons is that the coordination between the government and the state agencies and the civil society and the kind of resources that we have deployed has been exemplary. I mean, I know it's not fashionable to praise Pakistan, but WHO has mentioned us. And there have been, this is one area where we have got it right in the sense that we've been able to balance the economy with the public health requirements. Mm-hmm. But we cannot be complacent. India is a cautionary tale. This could very well happen to us. And we have, Allah na kare, Allah na kare. Secondly, sir, finally, somebody mentioned how you can help. You can always contact us. You can always come to the High Commission. You can talk to these Indus network in the UK, the Apne, but also come to the High Commission and we can see how we can help you. There is a problem with logistics. You might be able to collect all the donations, but sending them back to Pakistan would be challenging. The oxygen situation is updated daily on a daily basis by the NCOC, but we do need oxygen plants. We do need oxygen cylinders. And there is a call out from NCOC for looking for oxygen generation plants for 30 to 50 beds.
On that note, Dr. Faisal, the next question was actually regarding that, was lots of misinformation regarding the acute shortage of oxygen in Pakistan. What is the ground reality? I think you just started to touch on that.
I'd refer you to the NCOC website, which gives us some statistics about the oxygen availability. So my reading is that it is not alarming as yet. It's not as alarming, but we can't take our eyes off the ball.
Dr. Zafar, you had your hand up as
well? Yes. I'd just like to add that, I mean, more to what Dr. Bari was saying about, not receiving so many calls. Let's be cautious here and let's not be complacent, because myself and Dr. Bari are based mainly in Karachi. And the situation in Karachi is different than compared to Islamabad, Peshawar, and Lahore, where things are in a bad shape. And God forbid, such a big city here, that it could be affected as well. People have been lucky, areas have been lucky, but we have to be careful that in Lahore, the bed situations is difficult. In Islamabad, it has been difficult, and in parts of KPK as well. Luckily, in the last 2 or 3 days, there seems to be a little plateau in numbers. Allah khair kare that the numbers start coming down, as long as they stay within the health delivery that can be given. They can be managed. If they overwhelm it, that's when things go bad. So let's not take away from today's session that things are okay, they are fine, and we are not getting the numbers. No, that's purely more in Karachi. The rest of Pakistan is at the edge, and we have to be careful.
I'd just like to add there, I think, Dr. Bari, your proxy figure is a good indication, but as Dr. Sabah said, it's indicative of Karachi. I think even our religion teaches us that we need to have tawakkul, but we tie our camel first. So I think we need to be doing all the preparation we can, putting all the measures in place. We are behind India in the trajectory. We are a good few weeks behind them. So hopefully we won't get to that stage and we'll be able to implement all the measures and get the oxygen plants and everything running before we hit crisis. But we should all just make lots of dua that we don't get to that stage, but we need to take all measures.
Allah. Jazakallah khair for that. I think we might be at the end of the questions, so I'll give another minute or so in case anybody wants to throw something else at me. And then I'm going to pass over to Dr. to finish off and conclude the session. A reminder once again that if you want more information about the Indus Health Network, you can go to indushospital.org.uk. And of course, some of the panelists are here already involved and give the phenomenal network support and obviously help to build Pakistan to the next stage of its journey, inshallah. We pray that everybody's safe and we don't end up in a similar situation as to our neighbors, and we pray for them as well that Allah makes things easy for everybody who's affected. And for now, I'm just going to say Ramadan Mubarak and Eid Mubarak when it comes, although the next few days there's still a lot to do from myself. Shabi Ahmed, you wanted to put a final comment from Apne. Can you tell us what that is, please?
Assalamu alaikum, everyone. Can you hear me?
Assalamu alaikum. Yes.
Thank you very much for this very informative session. And really, we needed to know what is the ground reality in Pakistan before we, all these questions about support and aid and all these things are put into place. I just wanted to highlight that there was this question or comment raised regarding what the Pakistani physicians are able to deliver from here. Like we did the telemedicine facilities last year, the Association of Pakistani Physicians in Northern Europe is already in motion of creating the same support facility, God forbid, if things go south. Along with that, if there is any need for help and support, then we will not be behind our diaspora, and we will do whatever is needed. However, we just need to watch how things evolve on a very close basis. And lastly, with regards to the vaccination, I think I had the opportunity of speaking with Dr. Bari regarding that a few days ago. And what my understanding is that there is reduced uptake rather than reduced provision of the vaccination. So our organization would also be working in terms of mass education at the level in Pakistan, and rightly mentioned by Dr. Samia with regarding the local dialects to be used to get the message across. So as long as the vaccination is concerned, we will try our best in terms of educating the masses, and hopefully, inshallah, the Cancino farm is being locally packed in Pakistan, and hopefully that might be the game changer in terms of provision. However, yes, everyone has to make their own efforts in this regard. Whoever can afford and not afford, people have to help each another. Thank you very much.
Thank you.
Thank you, Shabi. Dr. Mateen, I'm going to pass over to you to conclude the session. Thank you very much for myself, for the panelists, and everybody who's taken part with their questions. And once again, Ramadan Mubarak and Eid Mubarak when it comes, inshallah. Dr. Mateen, over to you.
Thank you. Jazakumullah khairan, Naeem. Thank you for conducting this. Yes, in the end, I would just like to thank all my panelists, Dr. Abdulbari Khan, Dr. Zafar Zaidi, Dr. Samia Latif, and Dr. Faisal Aziz. Of course, mashallah, we've got so many doctors on the panel now. And Dr. Asif Rangoonwala, he had to leave. So, of course, great. Thank you to him as well. And Kamyla Marvi from joining us from Pakistan. And to all our attendees as well, thank you so much for joining us. And please do remember us in your prayers. Please do continue your support. And of course, support of Apne and of course of Shabi Ahmed and Ahmed Bernie. It is also much appreciated. We will continue to work together, inshallah, whatever we can and whichever way we can. And of course, we'll take up the offer of Dr. Faisal Aziz to do get in touch with the High Commission for anything. And of course, the list that you have shown, we'll be happy to look at it as well and see what we can do from here to support that from within the diaspora community in terms of raising funds and whatever we can. So once again, thank you so much, everybody. And Jazakumullah khair, dua mein yaad, continue your support, and Eid Mubarak to you all.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.